My name is Alicia Barron, and I'm the Executive Director at the Infusion Access Foundation. I became involved in the chronic illness community way back. So my dad was diagnosed with multiple sclerosis when I was 16. And so that was really my first foray into this world and seeing how complex it was and how expensive it is and how it really affects so many people within this community. And so when I started to figure out what I wanted to do with my life and who I wanted to be as an adult, I decided this was a place where I could really make an impact. I wanted to make sure that no other family like mine was affected the way ours was. The Infusion Access Foundation is a patient advocacy organization that works to ensure that people living with chronic illnesses that utilize provider-administered medications have full access to those medications. That includes things like ensuring that they have accurate coverage, full coverage of these medications, that they're affordable, and that they can actually get them in a way that they would prefer that they receive their medications either in their homes, at an infusion center, at their doctor's office. We really work to ensure that that decision is made between the patient and their provider and not necessarily dictated to by insurance companies or any other factor that's outside of that very intimate relationship between a patient and their provider. One of the missions that we have for the Infusion Access Foundation is we really want to become the convener of all of these different audiences. Absolutely, we love working with our patients and our patient groups and partners. We also want to make sure that we're connecting those folks to our industry partners. Sometimes that's the biotech industry, the pharmaceutical industry, but also the insurance industry and the infusion center industry, and to be able to become a convener of all of these different voices. We sit right in the middle of all of this, and so we have a really unique opportunity to be able to collect all these people and get them together, because frankly, our shared mission is exactly the same. Instead of all of us saying the same thing, let's really figure out what exactly can we do to really get to that point.